Ini US Weekly Roundup powered by PSG Group of Companies in Life and Health.
Thank you, Dr. Simi Jesto. Hello, everyone. My name is Dr.Rose Vadakara, and welcome to a new segment of Life and Health. In today's session, we are going to discuss about a slow progressive eye disease, also called as glaucoma. To discuss this topic, we do have a board-certified ophthalmologist with more than 20 years of experience, and she's also specialized in glaucoma. It's none other than Dr. Nina Goil. So she is an assistant professor. She's a director DEI of Rush University Medical Center. I'm very honored that she is actually the president of the Illinois Society of Eye Surgeon and Physician. It is really honored to have you, Dr. Nina, for today's Life and Health segment.
Thank you for having me, Rose.
All right, doctor. So let's begin our session by understanding what is glaucoma and who does it affect?
So glaucoma can actually affect anybody. There are certain populations where it is a little bit more prevalent, but it is prevalent in the South Asian community, in the Hispanic population, as well as in the African American population. So what is glaucoma? Glaucoma is a pressure problem of the eye. So I often say that I'm the plumber of the eye. I handle fluidics of the eye. And it is when the pressure in the eye is too high for these structures in the eye to be healthy.
So is it a genetic problem, and what actually causes it?
So it's multifactorial, as many diseases are in the body. And part of the answer is we don't actually know that there's any one root cause. It is genetic. There is definitely a genetic component, so it runs in many families. And if the prevalence is high in one's family, one should definitely keep an eye out for it. It is age-related. It's uncommon to be in young individuals. There are some variants, of course, congenital glaucoma or juvenile glaucoma that people have at a young age, but typically it's an elder population disease. And in terms of other factors that may coincide, other ocular conditions may cause glaucoma. And those are secondary glaucomas, where you have inflammation in the eye, or you have diabetic retinopathy. So these are conditions that then lead to pressure problems, but they are not glaucoma as the primary issue.
Okay, regarding the pressure, so is glaucoma only diagnosed when the pressure is high, or a patient can have glaucoma without their eye pressure being high?
That's a very good question and a very common misconception. Patients will often say, I can't have glaucoma because my pressure has always been in the normal range. And another corollary to that is, what is the normal range? Typically between 10 to 22 millimeters of mercury is considered a normal number. That number can be variable, and there's a lot of factors that go into that measurement. So if you tell me your pressure is 22, you may think, hey, that's a normal number. But if you have thin tissue, then we're underestimating your pressure. So there's a clinical component to it that's not as simple as saying it's a high pressure problem. And another issue is that you can have low pressure glaucoma. And that's a very commonly missed diagnosis in many communities, because people say, hey, I've had a normal pressure this whole time. I can't have glaucoma. And in these patient populations, they have a weakened optic nerve, a structurally weak optic nerve, or they have a vascular problem where they don't have good blood supply to the optic nerve. So to go back to your original question, what causes glaucoma? Typically it is pressure, but it is a disease of the optic nerve, which can be caused typically by pressure, but other factors which then lead to a glaucoma as well.
It's very interesting to know that our eyes does have pressure. You know, we normally know about like our blood pressure.
Absolutely.
Yeah, it's
and
very
patients will often ask that. They'll say, does my blood pressure cause eye pressure? And the answer is no. They are two completely different systems.
Okay. So how do you diagnose this?
So you need an eye exam.
Okay.
You start with the eye exam. And in the eye exam, you should have a ocular pressure check. But that is not enough. A pressure check is not adequate to diagnose glaucoma. You need to have a full dilated eye exam where your optic nerve is visualized with an eye care professional. In many cases, it's an ophthalmologist, an eye surgeon. You can also go to your local optometrist who can check for these diseases.
Okay. When will you recommend to start doing these eye examination to check glaucoma?
So specifically for glaucoma, I would say most people start coming in their 40s because they start having eye trouble or vision trouble. And so they're coming for glasses or difficulty with near vision. And these conditions are automatically checked for. Cataract, glaucoma, macular degeneration are the big three. And that's a built-in check during your eye exam. I would say after age 50 is a good time to start going for annual visits, if not every 2 years. After age 60 to 65, absolutely you should be going in every year because the risk of conditions goes up.
Okay, what are the common symptoms that they will be mentioning, like, oh, I'm losing my peripheral vision? Like, what are the common symptoms they say to you?
So glaucoma is known as the silent thief of the night. That's what we call it, because it is a silent disease. You will not feel the intraocular pressure in your eye unless it is sky high and it's a different disease state. So what will you feel? Well, you will feel perhaps peripheral vision loss, but that is a very late stage symptom.
Oh, okay.
So by the time you've lost peripheral vision, it is very late in the disease, and once you have lost vision, we cannot bring that vision back. That is a permanent nerve damage. Just like a spinal cord injury, we can't regenerate nerves.
What can we do for those kinds of patients?
Those are very, very good questions that you're asking, because if the patient does not or cannot put the drop in their eye, then they are not getting the treatment, and this irreversible disease is progressing. So in terms of eye drops that burn, they should talk to their physician and let them know that I'm not able to use this drop. And we can think of other alternatives or another medication that may work. Oftentimes using a lubricant eye drop will help. So take a lubricant drop before your medication, wait 5 minutes to avoid dilution of your drop. And then after 5 minutes of the drop having stayed on the surface of the eye, use another lubricant drop, and that will help tolerate the drops. Another little secret I like to use is to put the eye drop in the refrigerator.
Okay.
And that feels cool to the eye, very soothing, and much easier to tolerate. The main thing is then you have to remember to go to the refrigerator and use it, which brings to the point of adherence and remembering to use the drop. I say roll it into your routine. So if you are taking a nighttime eye drop, put it next to your toothbrush. So every night before you go to bed, you brush your teeth and you put your eye drop in. Another thing that is available now is there are apps that will ding you. Okay. They'll like set up a little alarm. So if you're a little bit tech savvy and you are on your phone, then it'll remind you to do it. But you have to do something consistently at the same time every day to make it a habit. And the day that you miss your drop, that day the pressure will go up. So there are repercussions to that.
Wow. Okay. I didn't know that eye drops can cause this many issues. So
Yeah.
what is new in glaucoma field? Is there anything new, procedures or surgeries?
Yeah.
You know?
So we'll start with drops. There are some new drops that are preservative free and combination drops.
Okay.
So instead of having to take 2 different bottles, now you can take it as one medication. It is very tricky with insurance. Sometimes some insurances will cover it, some will not. Many of them are now available as a generic. So it is easier for patients. I also recommend getting a 90-day supply whenever possible, because then you're not having to run to your pharmacy every 30 days and you're not running out at the end of the month. One other question you had mentioned earlier is how can patients use their eye drops? And there are some eye drop devices out there very readily available online that will help, where you put the drop in the actual device and it will help you to squeeze it. So patients who have rheumatoid arthritis, Parkinson's, because again, these are all elderly diseases, they will often use these devices to put the drops in their eye. Yeah. And in terms of what else is on the horizon, one of the kind of the cool, sexiest things in glaucoma right now is called MIGS, or minimally invasive glaucoma surgery. And these are intraocular surgeries. They are minimally invasive as opposed to the previous surgeries, which were majorly invasive and had much higher risk profile, risk of infection, risk of vision loss. They required a lot more healing. There's a lot of longer surgery involved. In the minimally invasive, we will often combine this with cataract surgery, and it just adds another 10 minutes. And we are basically cannulating or opening the drain internally, very much like a stent that they use in cardiology. In the old days, they would crack the chest and then do the bypass. Nowadays, we don't do that as often. We do if we need to, but if avoidable, they'll do a catheter up through the vessels and then stent the vessels that way. So this is the same analogous procedure in the eye.
It was very useful. I mean, a lot of information, but very, very useful tips, to definitely make into practice in our daily practice. So thank you so much, Doctor, for having with us today. I'm very happy. The session was very good. Thank you so much.
Thank you. Thank you for having me. I really appreciate it.
US Weekly Roundup powered by PSG Group of Companies in the episode of പൂർത്തിയാകുന്നു. നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും ദയവായി asianetusnews@gmail.com എന്ന ഇമെയിലിലൂടെയോ 732-429-9529 എന്ന വാട്സ്ആപ്പ് നമ്പറിലൂടെയോ ഞങ്ങളെ അറിയിക്കുക. മറ്റൊരു വൈവിധ്യമാർന്ന എപ്പിസോഡുമായി വീണ്ടും കാണാം അടുത്തയാഴ്ച. നന്ദി, നമസ്കാരം.
Crufase Law Firm, Chicago. Trusted name for work injuries and personal injury cases, wrongful death cases and much more. Ensuring aggressive financial results. Attorney Stephen Crufase. Serious lawyer for serious cases. We want a long-term relationship with you. Call us 312-855-0511. Crufase Law Firm Limited. www.crufaselaw.com.